Okay, today we are going to learn the sacral plexus along with the lumbosacral trunk. Let me show you the sacrum bone. Okay, on its adjacent side, you would be observing from superior to inferior, we will see the lumbosacral trunk that is being formed by the ventral rami of L4 and L5, right? Now, you see that if I can show you the anterior sacral foramen, and you can see the exit of S1, sacral spinal nerve, it's ventral ramus. Now come the ventral ramus of sacral spinal nerve 2. Now this is spinal nerve 3 and this is the spinal nerve 4. Their anterior or ventral rami on both sides, you will see that they take part in the formation of sacral plexus. Okay, now I have to turn it posteriorly, right? Now I have to turn it posteriorly, as you can see that again this is the sacrum, and of course these anterior rami, as they are supposed to now come on the both sides. Just I want to show you the sacral plexus as a whole, and downward you can see the formation of this sciatic nerve. Let me mark it, yeah, this one, that has to pass through greater sciatic foramen. Now through the greater sciatic foramen it is going to enter into the gluteal region. You can see the course below. Let me trace it, that sciatic nerve. Now let's see the branches from the posterior aspect of the sacral plexus. The superior gluteal nerve, the inferior gluteal nerve, this is the nerve to piriformis, and this is the nerve to obturator internus. Now this is the posterior cutaneous nerve of thigh. This is the inferior coloneal nerve. And now we can observe the perennial branches coming from the posterior cutaneous nerve of thigh, right? Now here the left hip bone is being removed, and I have to turn it a little bit towards the interior aspect to show you the relation of these sacral plexus with that of a muscle that lies behind it. This is the piriformis, right? Shown in a light pink, or you would say transparent sheet like colored, right, muscle. Okay, now let me correct the position accordingly so that you can get the clear view. Now I have to turn it posteriorly. On the right side, what do you see? That was the piriformis muscle, and this is the gluteus maximus being cut. This is the gluteus medius, right? Now there are other muscles you have to learn. This is the obturator internus. Above that, that is the gemellus superior. Below is the gemellus inferior, and this is the quadratus femoris muscle. Now you can see that the piriformis is present posterior to this sacral plexus, and just below you can observe the sciatic nerve. And now we will see various branches. This is in green is the posterior cutaneous nerve of thigh. This is the inferior gluteal nerve. Okay, let me mark the, if I can show you, over the gluteus medius there is the superior gluteal nerve being shown in red, but I cannot click it to show you the name, right? Okay, this is the nerve to obturator internus being shown in purple color, right, as this is the muscle, the obturator internus. Now that was the perennial branches of the posterior cutaneous nerve of thigh, right? This is inferior coloneal nerve, right? And you can see the descent of posterior cutaneous nerve of thigh, right?